Hello, physios. Right now, we're going to see how to take a biopsychosocial history for a chronic pain patient. So, in that first one is somatic dimension. In our previous reel, I have covered somatic characteristics of pain. So, go and check that. So, now we are going to see psychological dimension. So, first one is cognition. So, what are the expectations regarding a physiotherapist by a patient? And second, attribution. So, how the patient's explanation for the complaints, and third is catastrophizing. So, thoughts and reactions to the symptoms and the complaints, how the patient react, you should mention. And next, self efficacy. So, feelings of control over symptoms. So, does the patient can able to do things to decrease the complaints? And it's all included in cognition. So, second, emotion. So, feelings about the symptoms, emotional balance, insecurity, depression, anxiety, feeling overwhelmed, we need to mention in our assessment. And third, behavior. So, in that behavior, how the patient respond to the symptoms. Does he attempts to decrease the symptoms, success of their strategies, which is dealing with the complaint, how they dealing with the complaint. And second is functional limitations. So, what are the activities they cannot able to do? And third is avoidance. So what are the activities discontinued during or because of the symptoms, anxiety about activities, what other people notice about behavior during symptoms. And talking about the complaints, so how often the patient talking about it, with whom, and what the patient says, we need to mention that. So these are all about psychological dimension we need to mention. And next one is dimension of pain. So, do other notice the patient have complaints, or what the other people notice or think, how others react to the patient's symptoms? So, what is the patient's partner think about the causes of their complaints, and how do their partners feel about this? And does this complaint affect their social life or work, hobby, or sport? We need to mention. So, that's a way we need to assess the biopsychosocial aspect of the chronic pain.